All right, welcome everyone. Thank you so much for joining us today for our webinar on the Cal-OSHA COVID-19 regulation revisions, which are still ongoing, as I'm sure everyone has been seeing. It's been a rather exciting time. So this webinar is supported by the UC Davis Western Center for Agricultural Health and Safety. They are one of our lovely sponsors and they're help bringing this information to you free of cost. So first, we do want to let everyone know that this webinar is available in Spanish. Para escuchar en español, busca en la barra de herramientas en la parte de abajo de su pantalla y haz clic en el botón del globo que dice Interpretation y elige Español. We will also be recording this webinar and sending it out after the fact. So if you have to leave early or you're catching this later in the day, not to worry, and you'll still get all the access to the information. So this afternoon, we are joined by Lisa Baiocchi. She's a senior associate at the Prince firm in Santa Rosa, which concentrates its practice in Cal-OSHA and Fed-OSHA and crisis management. Since 2012, she has represented employers in all aspects of Cal-OSHA and Fed-OSHA administrative process and defense, as well as amicus curiae and appellate briefs. Lisa has also assisted employers with crisis response, improving and updating the safety programs, as well as with managing pre- and post-appeal abatement issues before Cal-OSHA. Her clients encompass a wide variety of industries, including construction, wineries, agriculture, wastewater, treatment, and manufacturing, to just name a few. We'll also be here from Dan Leiner, the area manager of the San Fernando Valley Cal-OSHA Consultation Services Office. He has almost 30 years experience in the health and safety field as an industrial hygienist, and he holds a BS and MS in environmental and occupational health from CSU Northridge. Dan was an instructor with CSU Dominguez Health Certificate Program in Environmental Safety and Health and with their OSHA Training Institute Education Center before joining UC San Diego's OSHA Training Institute Education. Throughout the entire presentation, feel free to use the Q&A feature to send in your questions, as I'm sure we have a lot, so we definitely want to take advantage of both Lisa and Dan's expertise to get those questions answered. With that, I'm going to stop sharing and invite up Lisa.
Okay, can you see me okay?
Yep, looks and sounds great.
We'll share my screen. Okay. So I don't know if this is happening to anyone else. At least when I was watching your screen, there was a little prompt for the meeting being recorded that was overlaying everything. That's not happening to me, but in case it's happening to you, perhaps that can be moved. Anyway, thanks all for being here. We will, as Kimberly said, put your questions in the Q&A, and we decided it would probably make the most sense for Dan and I to take questions at the end. Reason being that I plan to kind of cover the background of the ETS, what is going on now and what we might expect to happen. And then Dan will be covering the changes, at least so far. And so it would make sense to hold questions until the end, but certainly we want to get to those, so make sure that you do put those in there. So with that, we will move into my disclaimer, because I am an attorney. So there you go. I won't make you read through it, but COVID is fluid, as we are all aware of, especially in the last few days. So we will do our best to be up to date on this, but literally it could change tomorrow. So just be aware. So where are we now? You know, if you've been following this, it's been probably the most drama the Standards Board has ever seen. The meetings are not normally this interesting or exciting. So if you do have an opportunity to sit in on the Standards Board meeting, now is the time, but also because this is a pretty important issue. So back on May 20th, not even a month ago, the Standards Board had a regular meeting, and they do have regular meetings. You can check their website for those and attend as a public participant. In this particular meeting, they were addressing several issues, but they did address, of course, the ETS, the Emergency Temporary Standard for COVID. As such, there were more than 600 participants, which is a lot by Standards Board standards. As a result of that, public comments went on for a very long time. And the board listens to each and every one of them. And to preface this, literally the day before that meeting, Cal OSHA had sent a letter to the Standards Board requesting a delay on the vote on the proposed updates to the ETS. So those were updates that Cal OSHA had drafted and provided to the Standards Board. The point was the board was going to review, take public comment, and vote. But literally the day before, Cal OSHA requested a delay. The reason for that being that the CDC had just come out with new guidance. And Cal OSHA had asked for the board to delay the vote in order for them to go back and make some revisions to the proposed language to take into consideration the new CDC guidance. The board did still go through with comments and deliberations and discussion, but in the end did agree to grant Cal OSHA a brief extension so that they can go back and prepare some updated standards. So that CDC guidance that Cal OSHA was referring to came out in May, literally just before well, maybe it was a week or so before the Standards Board meeting. And it really centered around fully vaccinated people. So according to the CDC guidance, fully vaccinated people can essentially resume most of our normal functions. That means no need to wear a mask, no need to physically distance, no need to get tested if you aren't known to have been exposed or you're asymptomatic. Also, no need to quarantine following an exposure if you're asymptomatic. So these are all pretty big updates to the CDC guidance, but certainly differentiating vaccinated from unvaccinated individuals. And as you can imagine, that created quite a lot of confusion and concern on behalf of employers and employees. So in conjunction with CDC updates and guidance, in very early June, the California Department of Public Health updated their guidance. And this was to reflect the fact that it was expected that Governor Newsom would be opening the economy of California on June 15th. You know, this is of course based on his public statements and everything we've been hearing, so that's what we are anticipating. At that point, California Department of Public Health stated that that means there would be no capacity limits on venues or businesses. Physical distancing requirements would go away except for mega events. And that's something I think Dan will probably bring up as one of the provisions that the division has addressed. Again, in line with CDC here, fully vaccinated people don't need to wear masks outdoors. So that is an important term there. Because masks would still be required indoors, regardless of your vaccination status. Now, keep in mind, this is the California Department of Public Health. They are not Cal OSHA. So this is guidance for the public, but not necessarily businesses. That being said, considering it is the state's guidance, it is something that Cal OSHA decided that they would need to take a look at. And so that takes us to the Standards Board's January 3rd emergency meeting. This was the meeting that was called after that May meeting in which the division requested an extension. It's called an emergency meeting because it is outside of their normal meeting times, and they haven't had an emergency meeting in maybe a decade. So this was a big deal, if you may. This meeting was, I think, probably heavily advertised in some way because there were at one point up to 800 participants. That's significant. And the public comment period was at least 6 hours. I put that because I didn't actually keep track. I was there for all of it, but It was at least 6 hours, but maybe it was more. And then there was plenty of appeals board deliberations. The board certainly went back and forth in their deliberations. If any of you participated, it was very interesting. Lots of discussions. The ETS was the proposed updates to the ETS were voted down, and then the board went on a break, and then they came back and they changed their mind. And the reason being, really it was the lesser of two evils. What the board, I think, realized was by not approving the updates to the ETS, they were therefore leaving the current standard in place. So what we have now would have remained in place, which is arguably more strict. So that meant there would be no easing of the ETS in conjunction with the state opening the economy, updated CDC and Department of Public Health guidance. So, my take on it is they thought about that and realized, well, maybe we better just go ahead and go with the updated proposed ETS language because it's less stringent. So that is what they ultimately did. Now, actually, I should go back real quick. As part of those deliberations, the board did state that they were going to put together a committee to work with Cal OSHA on further updates to the ETS because they felt that the updates didn't necessarily encapsulate all of the CDC recommendations that had just come out. So that was where we were left on June 3rd. ETS language was approved, and the board and Cal OSHA were going to collaborate, hopefully, on some further updates. And now we can move to literally June 7th, which was, I think, 2 days ago, when California Department of Public Health came out with more guidance. So this is updated from their guidance in early June. Again, June 15th, California plans to transition to operations as usual. CDPH has indicated that they will align themselves with the CDC face covering guidance. That means face coverings no longer required for fully vaccinated people. There's not a distinction there anymore. That's across the board. They are still required, face coverings, that is, for non-vaccinated people. And that means indoors and in businesses. The hard part in their guidance was they left this up to businesses as to how they would enforce non-vaccinated people masking. They give some suggestions for how that might be accomplished, but left it up to the businesses to make that decision, which, as one can imagine, would be very challenging to figure out. Nonetheless, that's where they left it. They did state at the end of this guidance letter that they put out that employers are still subject to the ETS, meaning, as I said before, California Department of Public Health is talking about the public. Cal OSHA still is going to govern and enforce the regulations for employers and employees. And I might add that this updated guidance came in the form of a letter to the Standards Board, suggesting at the end of this letter that the Standards Board and Cal OSHA might want to have a conversation and discuss updates to the ETS promptly because of the new guidance from CDC as well as CDPH. So that is as of 2 days ago. Another guidance that they updated was with regard to diagnostic testing. So this guidance, and you can find it on their website, basically they are saying fully vaccinated people don't need to be tested anymore, unless you have workplaces that are of increased risk or high density. They had some suggestions on the website for what those might be. And they didn't necessarily say it was required. They said perhaps you might be doing some testing in these situations. They're recommending once a week, but again, it's not mandated. They do say, and I would certainly recommend, if you are doing testing of any kind, have a plan for tracking that. Have a plan for tracking your results, have a plan for tracing, and also for reporting. And that honestly should probably be part of your COVID plan anyway, but make sure that that is being implemented. And I think this was maybe yesterday that this was announced, that the Standards Board will be having another meeting. This one's a special meeting on June 9th. I believe that's tomorrow. Oh, that's tonight. So this is unprecedented, but here we are. They are calling a special meeting, and this is to consider this new information / letter from California Department of Public Health, who has stated that they will be aligning with CDC. There is an updated agenda now also for the regular meeting on June 17th to include proposal for re-adoption of the ETS. So what does that mean? When they say re-adoption, it doesn't mean re-adoption of the current standard. It doesn't mean re-adoption of the original standard. It means consideration of proposed updates. And when you're dealing with an emergency standard, anytime you are updating that, it's actually basically re-adopting the standard, but with those updates. So what does this mean? We don't know. I'm curious to see what the appeals board discusses and whether they've actually been able to deliberate at all in this short period of time. But certainly it seems like they're considering both CDC and CDPH guidance. But in light of OSHA's mandate to enforce safety and health in the workplace, and whether that guidance is going to be able to be translated to the workplace. There's a lot of complications that go along with that. So perhaps we will know more after this meeting. If you are able, I would recommend attending. I'm sorry, I don't have the time. I think it actually is this evening, which is also unusual. Typically their meetings are earlier. So if you're able to attend, I would recommend it. But I'm sure there'll be something in the news tomorrow. So where do we go from here? Currently, the proposed ETS language that the board did vote on a week ago will be approved by the Office of Administrative Law. That is the next step. And then it will likely go into effect in time for the June 15th reopening of our economy. That will happen unless the Standards Board does something in the meantime. Certainly they seem to have the power to pull that back or maybe make some changes or whatever they decide to do. But if they don't do anything, the proposed language from the division's update will go into effect, which is something that Dan will be covering. As I mentioned, they've said they were going to convene an advisory committee. That seems to be maybe what they're doing tonight or behind the scenes. But all I can say is at this point, expect OSHA to enforce the standard as it's written. It does not matter what the CDC guidance is. It does not matter what public health says. It is what the emergency standard says. So as of right now, it is still the original version. As soon as the Office of Administrative Law passes the new version, that's what will be enforced. So while we have all this other guidance for our personal lives, certainly be aware that the ETS is still the law of the land when it comes to employers. So what is in, and what are you going to have to deal with as far as the updates to the standard? And again, Dan's going to cover this in more detail so you understand exactly where to find this. But what are the implications of these updates? One of the things that really came up frequently at the Standards Board meeting was this issue of employers having to provide N95s for employees. The standard does require that employers must provide N95s for all unvaccinated employees. And that is for voluntary use, so you do not have to have a respirator protection program in place. You do have to provide them with an appendix, but you have to have enough N95s for everybody who is unvaccinated. Now, they don't have to use them. That's the catch. So you may have one and it's available, but they can decide to use whatever other face covering is appropriate under the standard. So this, creates an issue for employers, of course, because you have to have a stockpile to be able to accommodate all of your employees who are unvaccinated for however many days or hours of work that they have throughout the week. And they're not supposed to be reused. So you can't give a respirator to someone and then they use it all week long. Conceivably, they need a new one every day. Now, you don't know if they're going to use it or not. Everyone seems to complain that they're uncomfortable. So you may just have a stockpile that sits there, but it's going to be a challenge to figure out how to plan for that. And I know that is certainly a big concern for employers. Employers are supposed, as a result of that, of course, employers are supposed to keep track of who is vaccinated. I have no answer for you on how you're supposed to do that. Obviously, there are a ton of privacy issues that are relevant. This all got brought up before the Standards Board. The division has promised on both of these issues to provide guidance in the form of FAQs. I am not aware that those are up just yet, but they have promised to provide them as soon as possible. Keep in mind, FAQs are not enforceable. Certainly they are helpful and one can point to them when you're trying to comply with the regulation. However, they are not necessarily the regulation. They're meant to just provide some guidance. That being said, it's the best that we have. So certainly I would keep your eye on the FAQs of the division's website to give you some guidance on how you're supposed to track unvaccinated people in a way that protects their privacy. One of the interesting things in the standard is this deadline they've put in of July 31st of this year. At that point, certain things change according to the regulation. For instance, physical distancing, employees waiting for transportation. So certainly be looking at the regulation for what changes occur on that date and moving forward. That is if we don't have some updated standard by then as well. One thing to note is that the original version of the emergency standard was set to expire in October. When the Standards Board adopts a new version or updated version or re-adopts as they call it, this means that that expiration date gets extended out. So now that October 2021 date has been bumped out by at least a few months. And again, if they update it in another 2 weeks or another month, it has the same effect. So keep that in mind, keep your eye on that deadline. The appeals board did hint that they could come back and look at the standard in a few months and decide it's not applicable anymore. But right now they really do seem to think that it is needed, that the IIPP is not enough, and that it needs to, some version of it needs to stay in place at this time. Of course, as soon as the standard is updated, you will need to update your COVID prevention program. Hopefully you all have one in place. If you don't, I highly recommend that you do, but certainly make sure it is up to date, because should the division come in for an inspection, it is one of the first documents that they will ask for, and they will be checking that you are up to date. My public service announcement is keep it separate from your IAPP. Do not merge these two documents. You can have them in the same binder with different tabs, but they should be separate standalone documents. So how has the division been enforcing the current regulations? As I mentioned before, there's a ton of guidance on the division's website, overwhelming amount of guidance. It is general and industry specific, and it is constantly changing. So again, it's difficult, but I highly recommend you check it at least on a weekly basis to look for updates, because whatever that updated guidance is will be what the division is likely looking to as enforcement. As far as the citations that have been issued so far, they're predominantly serious citations. I think I have one case in which there was a general citation for a COVID-related violation. Almost all of them are serious and with significant penalties associated. A lot of the inspections come as a result of complaints or a specific reported illness or an outbreak. So as you can imagine, that falls within certain industries more often than not. So that has been the division's focus thus far. And it was even mentioned by Eric Berg at the Standards Board meeting, some of the outbreaks and clusters that they are still actively investigating. So that certainly is still a major focus. The interesting thing with the appeals board has been that any case that involves a COVID citation will be expedited. And if you have been fortunate enough to never have an appeal before the Cal OSHA Appeals Board, I will briefly explain what that means. Expedited cases are what they sound like. They are quicker and shorter lengths of time to take the case to a hearing. This is typically reserved for cases where you have a serious citation that is not abated. The idea being, if you have a potential hazard out there that can't be fixed, the board wants to get the appeal resolved as quickly as possible. Here, the board is choosing to go ahead and expedite cases that involve COVID, even if those serious citations have been abated. So that means you fixed the hazard, but they're still going to put those cases on the fast track. Certainly we have our theories about why that's the case, but just know that should you end up with an appeal, that's the process and it moves quickly. At least in our experience, we've been having some frustrations as far as that goes. Certainly when you have an expedited case, deadlines come and go very quickly. And we have found that the board tends to not hold the division and the division's counsel to the same type of deadlines that an employer is held to. It's been a bit lax, and I have my speculations as to why, but just know that it can be a little bit of an uneven playing field at times. And all these cases are only just now starting to go to hearing. I know our office is handling several. The outcome will be interesting, but that's about where we are in the process with these cases. I will say that almost every single citation that's been issued for COVID, as far as we're aware, has been under the IIPP standard, not the emergency temporary standard. Now, it's possible that that's because the ETS did not go into effect until November of last year, and it's taken some time for inspections to occur once that was in place. But thus far, I'm aware of one case in which the ETS has been cited. So it makes you wonder if the ETS is totally necessary, but there you go. So keep in mind, you still have to be complying, of course, with your IAPP, hazard inspection, hazard correction, training, that type of thing. All the things that are required under the COVID standard, but under the IAPP as well. So, as I mentioned, there are a ton of resources available for the COVID-19 regulations. I checked all these websites to make sure that they are still valid, and they are. So you can take a snapshot, or I can provide a copy of the PowerPoint if you would like. As I mentioned, FAQs, there's a whole list of them, certainly worth keeping track of. As Dan, I'm sure, is aware, the consultation has a number of webinars on their website that you can look at, and they come up at different times, but certainly those can be really helpful if you're looking for specific guidance. If you don't have a COVID prevention program, the model program that the division has provided is actually pretty decent. If you're starting from the ground up, so I would recommend taking a look at that if you need to, or to just make sure that your program is following along with all the requirements. We're not talking about this today, but you're probably aware of AB 685 that was passed last year also. The division has some guidance on that because there are some crossovers and possible conflicts with the ETS. So I think it's worth seeing what Cal OSHA has to say about that. There's industry-specific guidance, as I mentioned, and then the California Department of Public Health, like I said, at this point, ETS is still the main guidance, but I still think it is worth keeping track of what Department of Health is saying, because clearly it is impacting how the Standards Board and Cal OSHA are approaching the ETS at this time. So I think that's all I have at this point for where we are. And again, I'm happy to answer questions at the end. I'm sure you will have plenty, but I'd like to at least let Dan get into the specifics of what the current changes are to the Cal OSHA regulations. So I think I will stop sharing my screen.
Thank you so much, Lisa. That's very interesting insights you have there. Like Lisa said, keep sending in those questions. We are keeping track of them and we'll address them at the end. But for right now, Dan, welcome on up.
All right, thank you. I'm going to go ahead and share my screen. Hold on. First off, I'm going to apologize for not having a PowerPoint. In order for me to develop a PowerPoint that's current and up to date, it would need to be approved by our agency. And the last time I developed the COVID-19 presentation, it took them several weeks to make the approval. So what I'm going to do today is work off of our website to inform you of the information and let you know where to find this information on our website. So I'm going to continue on with what Lisa was talking about. First thing I just want to point out real fast is this link under quick link. So first off, Cal OSHA's website is, we're part of the Department of Industrial Relations. So the Department of Industrial Relations website is dir.ca.gov. And then if you go to the DIR website, you can find right here is a little link that says Cal OSHA Safety and Health, or if you're typing in the website address, the dir.ca.gov, if you add a /and DOSH for the Division of Occupational Safety and Health, that will take you to Cal OSHA's webpage. Lisa was talking about the COVID-19 related violations, mostly being related to the IIPP. Some of the, there was legislation that required Cal OSHA to post all COVID-19 related violations on our website, and they're posted by date. So when you see some of the newer citations, these were issued May 26th. This was for a dental supply company. It was an inspection because they had a fatality, and they received almost $5,000 in penalties. And if you click on the inspection number, you can actually see the citations. And this inspection started on January 27th of this year. Any inspection that started before the emergency temporary standard adoption date of November 30th of 2020, the IIPP was used to address COVID-19. So if we look at the citations here, I'm going to blow it up a little bit. This was after the adoption date of the emergency temporary standard, but you'll see right here, the entry and illness prevention program was still cited. But this was related to not having an effective entry and illness prevention program. Lisa mentioned if you're inspected by Cal OSHA, that they will definitely be asking for your COVID-19 prevention program, but they will also be asking for a copy of your injury and illness prevention program. That's required on 100% of inspections. So when they, on this inspection, when they evaluated the IIPP, they found some of the elements were missing, and they issued a $185 penalty for not having an effective IIPP. Then you get into some of the other citations. Now we're getting into 3205. So 3205 through 3205.4 are the COVID-19 regulations. And if you go through these, here's one for COVID-19, that they didn't have an effective written program. They got cited $375 for that because it was classified as a regulatory violation. But then you get into, this one, you get into the serious. This is for not having guardrails. That's unrelated to COVID-19. But here they did not have they did not establish the physical distancing requirements, and they received $4,500 penalty under the new COVID-19 prevention regulations. So I just want to point this out to people. The other thing you can do, this is posted by date, but I would recommend these first 5 columns are sortable. I would recommend sorting by industry code, the North America Industrial Classification System code. And anything that starts with 1 deals with agriculture. So you will see the citations that were issued within your industry. And you could see there have been quite a few inspections. There were a few inspections within your industry. So that's one thing I do want to point out up front. I want to talk about the COVID-19 regulations that are right now that have been approved by our Standards Board, that are now at the Office of Administrative Law for approval. And if you want to find those regulations and to keep up with what's going on, you want to check our Occupational Safety and Health Standards Board website. And on our webpage, we have this link at the very top that says boards, or if you scroll all the way to the bottom under our external links, you could see the Standards Board is listed there as well. So it's in 2 locations. You go click on the boards, you can go to the Occupational Safety and Health Standards Board. And then we're going to look, we're looking at an emergency temporary standard. So under the standards section, it's going to be listed under emergency. And here under emergency standards, we have 2 that were adopted as an emergency. One is protection from wildfire smoke. That became a permanent regulation last year, but the information is still here on the website. And this is the information here for coronavirus, for COVID-19. And if you click here, you'll find the original rulemaking information along with the original regulation that was approved by the Office of Administrative Law, which is known as OAL. We have the readoption document from June 3rd that was voted on at the June 3rd meeting that Lisa just spoke about, that they voted against it initially and then realized it was the lesser of 2 evils, that if they did not approve the changes, we would be stuck with this original document, the original regulation. And the also posted here is the information that was originally going to be voted on at the May 20th board meeting, but then Cal OSHA asked the board not to vote on these because CDC had come out with some changes that they wanted to incorporate into the regulation. Now, in my 27 years with Cal OSHA, this is the first time anything like this has ever happened. This is unprecedented. I've never seen so many changes like this, and I apologize. We are just as confused as you are. In fact, we just found out about the board meeting that's being held today. We heard about that. I got a news flash from the OSHA Reporter, which is a way to keep up to date on what's going on. So first off, I want to go to what was adopted at the June 3rd board meeting. And if you look, there's an agenda, there's a proposal for readoption action, there's a bunch of different documents. If you look at the proposed text for readoption, everything in that is underlined. So it's hard to figure out where the changes were. It's really nice. They provided this courtesy copy that's of the proposed text for readoption that actually shows the changes that were made. So what this document shows are the changes that were made to what was proposed at the May 20th meeting, or for the May 20th meeting. So let's take a look at this. Is everyone seeing this okay?
Yes, looks good, Dan. Thanks.
Okay, great. I'm going to blow it up so it's a little easier to read. This document that was voted on at the June 3rd board meeting has some major changes in it. And some of the changes you'll see are not underlined here because they were in the May 20th document. So we're going to take a look at that as well. So the latest changes mainly dealt with the physical distancing or the face covering issue. They added a new definition that was not included in the May 20th document. And this one was they added a definition of something called an outdoor mega event, which means any event that includes over 10,000 participants or spectators indoors, or outdoors, and may include convention shows, outdoor nightclubs, concerts, sporting events, theme parks, fairs, festivals, large races, and parades. So an outdoor mega event is something outdoors that includes over 10,000 participants or spectators. So that was one thing that was new. They've added a couple little clarification points. When you look at these documents, anything underlined is new and being added to the regulation. Anything that has strike through, which we'll see more of in like right here. This was the strike through documentation is stuff that is being removed, and underlined is what the changes are. Now let me go through this. I want to make sure that we cover a lot of the material, but we don't have a lot of time. And the other issue is, now that the Standards Board is having another meeting coming up, they're meeting today to try and get the regulation to match what the latest CDPH, the California Department of Public Health requirements are. I would expect this regulation to change then sometime within the next month again. So what happens is they voted on this regulation. They ended up approving it at the June 3rd meeting. On June 4th, it went to the Office of Administrative Law for final approval. The Office of Administrative Law has 10 calendar days to approve the changes or send them back. So if these get approved, these should be approved by, I would expect by the 14th of this month. And because the board is meeting again today to address some additional changes to align the requirements with CDPH changes, I suspect those might be heard at the June 17th meeting, or they might have some type of vote tonight. I'm not sure what's happening today. Again, a lot of this is unclear, but definitely expect additional changes to occur. So as you look through this, you won't see a lot of changes. Here in the training element, or part of this is you want to provide training on the company's policies, how to access testing and vaccination. That's already part of the existing regulation, but they're adding the part that you want to provide training on the fact that vaccination is effective at preventing COVID-19 and it protects against both the transmission and serious illness or death to workers. The physical distancing requirements, again, this talks about it applies until July 31st. Employers shall comply with either subsections A or B for people working indoors or at outdoor mega events. And again, it talks about that 6 feet of physical distancing, but they're getting to talk about the exceptions for people who are vaccinated. So here is where they're addressing some of those issues. A worker who's not, all employees who are not fully vaccinated shall be provided respirators for voluntary use. Now, when respirators are provided for voluntary use, you do not need to implement a respiratory protection program. However, our respiratory protection program does say you need to provide some basic training to the users of the respirators on the use and limitations of the respirators. And for something like an N95, a disposable dust mask, or also known as a filtering face piece, you would basically let workers know they do not provide oxygen in an oxygen deficient atmosphere. They do not protect against gases or vapors. They're designed for particulate or something solid, and that you should be wearing them in accordance with the manufacturer's instructions. Even if they're voluntary use, they should be used in accordance with the manufacturer's instructions. Now, federal OSHA has a letter of interpretation that says if they're used voluntarily, respirators are typically used for protection against harmful exposures. But for voluntary use, the assumption is there's not a harmful exposure to a chemical or to dust or something solid in the air. So somebody who's using an N95 on a voluntary basis could have facial hair because they're not being overexposed. However, when it comes to COVID-19, I would really encourage employers to encourage their workers to use them in accordance with the manufacturer's instructions, because if you have facial hair, that breaks the seal of the respirator to the person's face, and the air can leak through that way, through that gap or through the break in the seal, and it's not going to be as effective. So you want to provide the basic training, and Lisa also mentioned you need to provide workers with a copy of an appendix to the respiratory protection regulation, and you just need to make sure you give the employees a copy of Appendix D, as in David. This next section, the face coverings, this is what they are working on right now. Because these changes that were proposed for adoption really didn't address the recent changes to CDC and CDPH, the California Department of Public Health, did not adopt those changes by the time of these meetings. So it talks about, it still includes all of these things, that the face coverings need to be worn except when they're alone in a room, or when, this is the important one, when all persons in a room are fully vaccinated and do not have COVID-19 symptoms. One of the major concerns I heard at the June 3rd board meeting was by having non-vaccinated persons wear face coverings, continue to wear face coverings, that's going to identify who those workers are. And it might lead to some type of retaliation or harassment or bullying by coworkers. And you really need to get the point across that that is not going to be allowed, that's not permitted. And that even if you're vaccinated, workers still have a right to wear their face covering, including respiratory protection. There's the exception, for you can take your mask off when eating or drinking in the workplace, as long as you're 6 feet apart and blah, blah, blah. That hasn't changed. The specific tasks hasn't changed. But it does say down here, any employer not wearing a face covering pursuant to the subsections and not using an alternative when allowed by the regulation. So an alternative would be a face shield with a drape. That person would need, and they need to be at least 6 feet apart from other persons unless the unmasked worker is fully vaccinated, or they have to be tested weekly for COVID-19. And again, this is the part of that I think our standards board is going to be working on today for future changes. Unfortunately, when it comes to Cal OSHA regulations, we can't just wave a wand and just make these changes. They have to have public comment periods. There has to be posting. There has to be public comment at the board meetings. They have to vote on it. It has to go to the Office of Administrative Law for final approval. So this process, our regulations are always going to lag behind the public health department recommendations. And that's just the way the system is set up, that there has to be that input. And for the workplace, we're always going to be a little bit behind of what's allowed for the public. So that's pretty much what I wanted to talk about in this document. What I want to do then is also show you the May 20th document that was not adopted. But what was adopted in June 3rd, in this one we just looked at, included much of the changes that were in the May 20th document. So I want to touch on this quickly, that they changed some terminology. Instead of places of employment, they changed the name to work locations. They did say that this regulation does not apply to workers who are teleworking, but when your workers are teleworking, it needs to be from a location of the employee's choice, which is not under the control of the employer. So that's something new. They changed the definition of close contact, which was before COVID-19, the definition of COVID-19 exposure. This is all the same. They just changed the name. Instead of exposure, they call it now close contact. And there's an exception if they wore a respirator whenever they were within 6 feet of a COVID case. They added one definition to a COVID-19 case, and this is somebody who's tested positive or has a positive diagnosis from a licensed healthcare provider. That's in addition to a positive COVID-19 test. They took out part of this definition. They took out the COVID-19 exposure definition because they renamed it close contact. Minor word changes. They took out the definition of an exposed workplace. And this actually, I think, was a really good change in definitions, because a lot of people thought an exposed workplace was the entire facility. What they changed this to, and that was never the case. When you read through this and looked at our FAQs, it was really a particular part of the workplace where you were having an outbreak, where you had 3 or more cases, where the cases were occurring. And they changed that now to an exposed group, which means the persons within a work location or area or common area that have had an exposure. So it clarifies that it's not necessarily your entire facility, but it could be part of your facility. It could be maybe within, if you have multiple locations, it could be part of one of the locations within your facility. So it's a much better definition. The face covering definition was clarified. It means a surgical mask, a medical procedure mask, a respirator worn voluntarily, and it still includes the tightly woven fabric or non-woven material. But now these tightly woven fabric or non-woven material needs to be at least 2 layers. It cannot have any visible holes or opening, and must cover the nose and mouth. And they added what a face covering does not include, which includes a scarf, ski mask, I always say this word wrong, a balaclava, a bandana, turtleneck, a collar, or a single layer of fabric. The issue with a lot of these are a scarf, ski mask, balaclavas, bandanas, even when they're folded in half, a turtleneck. If I pulled some fabric over my mouth, that is a single layer, which will not meet this 2-layer requirement. They added a definition of fully vaccinated, meaning if they've had a Johnson & Johnson vaccine, which is the 1 shot, they need to they're fully vaccinated at 14 days after receiving the dose. And if they're receiving Moderna or Pfizer, the 2-dose vaccine, it's 14 days after the 2nd dose. They made a slight change to the COVID-19 for the high-risk exposure period. Basically says all of the following are true. It basically had some and ors in there, but now it says you have to meet all of these requirements. They added a definition of what a respirator actually is, and it's something that needs to be approved by the National Institute for Occupational Safety and Health, also known as NIOSH. They added a definition of work site versus workplace. And this is really, they added a note that this work site is specific to this regulation for part of it. Now, the written program, again, because there's some minor changes and definitions, had to be updated. So there were some minor updates, and I would expect that our sample written program will be ready to post the day of adoption of the changes or within a day or two. And that is based on when this regulation, the original regulation, was approved on November 30th of 2020. That next day, December 1st, on our website, we had a sample written program available. So I suspect they're working on the changes right now, getting them ready for when they're approved, and they will post those on our website. And I'll show you where to find those in a little bit. For the indoor work locations, they talked about originally about maximizing the quantity. They basically are saying you still want to get as much outdoor air into the facility as possible. You want to, if the system has filters, a mechanical system, you want to use the highest level filter that's compatible with your system, and that you need to explore whether you need to bring in some portable air cleaners that could reduce the spread of COVID-19. They talk about looking at CDPH's information on ventilation, filtration, and indoor air quality for some of the control. Let me jump down to another section where there's major changes were with the notification requirements. It talks about when it's always been with 1 business day that you need to notify workers that there's been a case in your workplace. It says they've changed to with 1 business day of the time the employer knew or should have known of a COVID-19 case, that it needs to be in writing in a form readily understandable by the employees that people at the workplace may have been exposed to COVID-19. It still cannot reveal any personal information. They've added various methods that are acceptable as notification, including personal service, where you hand somebody a letter, you email it to workers. If you have their emails, you can send it by text, whatever method that you can reasonably anticipate that it would be received by a worker within 1 business day, which eliminates USPS, the United States Postal Service. You can't just drop it in the mail. You need to have a method to get it to them within 1 day. The other thing they added that it needs to be, that if the employee, has limited literacy in the language of the notice, you still need to provide it in a language understandable by the worker. So that was a major change. And this still, again, requires notification to the authorized representatives of any employee. Let's see. The COVID-19 testing, again, now there's an exemption for testing for workers who've been fully vaccinated. And they've added an exemption for people who have for COVID-19 cases who came to work after they've been cleared to return to work, they can continue to test positive for up to 90 days. So those workers do not need to be tested again during that 90-day period where they can still test positive, because you would get a false positive test. So some of it, like I said, I'm going to kind of skim through this because there's a lot of stuff that's changed. That does say whenever respirators are provided for voluntary use, you need to provide some basic training on how to wear it and how to perform a seal check. And that is done every time the respirator is put on, and the fact that facial hair can interfere with the seal. A fit test for an N95 is basically having the person put it on, cupping their hands over the mask as much as possible, then doing sharp inhales and exhales in accordance with or whatever the manufacturer recommends for that the seal check, to feel for some type of leakage, because again, you want the best possible seal against the person's face. The physical distancing, again, this section will apply until July 31st. After July 31st, physical distancing will go away altogether. But for the physical distancing required until July 31st, there are some exemptions. That is if they're wearing a respirator required by the employer. You do not see the word voluntarily in here. This means you have a respiratory protection program implemented at your facility. This is where respirators are required. The other time you're exempt from physical distancing when at locations where all employees are fully vaccinated, except those who require a reasonable accommodation because of a disability under ADA, Civil Rights Act. And then you want to make sure that those workers are tested at least once per week, things like that. So like I said, I'm going to skip through some of this because a lot of this, again, might be subject to change. The engineering controls are, again, for the physical distancing. If you have engineering controls, they need to stay in place until July 31st. After July 31st, the engineering controls can be removed. I would still encourage, especially if you work with the public and all, to keep those barriers in place, because we're relying on people being honest about their vaccination status. So definitely you want to, I would really encourage some of the barriers to stay in place. There's some little changes to the PPE section, again, to address the voluntary use of N95 respirators. And there's some changes again for, as Lisa mentioned, if people are fully vaccinated and have an exposure, they don't need to be excluded from the workplace provided they're not having any symptoms. The other things that have changed, I'm going to skip down to a couple little, to the next section, the minor outbreak section. They did some minor changes to some of the wording. It still applies, and it's more clear now that this section applies until for the exposed work group until you've had no more cases within a 14-day period. The other major change to this section, they talk about the exclusion. They took some of the information out because it was already included in the main regulation, so it was duplicative. But one thing they did do is this was in the major outbreak section that's basically talks about if you have a minor outbreak, you need to keep people as far apart as possible. You need to have your physical barriers. You need to be in compliance with section 5141. And this part right here was specifically just word for word moved from the major outbreak to the minor one that talks about using MERV 13 or higher filters in your ventilation system if compatible. If not, use the highest one available, highest MERV level compatible with your system, and then look at whether you need to bring in portable filters. And then they removed some of the sections for being duplicative. The major outbreaks, again, they did some minor wording changes. This again, some of the changes, mainly because it's duplicative of what was in section 3205. This part was moved to the minor outbreak section. The housing part has some minor changes. So if you're providing housing to workers, right here, this section does not apply to employer-provided housing used exclusively to house COVID-19 cases or where housing units house one employee, which I think is very rare. And it does not apply to housing in which all residents are fully vaccinated. So, and again, it kind of talks about cohorting and grouping people together. And then this one, they talk about the beds. Ensure beds are spaced to allow at least 8 feet apart between the corners of the head of each bed, positioned to maximize the distance between sleepers' heads. When I saw this, I came up with, did they make this more stringent by making one edge of the bed has to be now 8 feet apart from the other edge of the bed? Or are they saying like a particular point of the bed, like the center of that bed to the center of the next bed now needs to be 8 feet apart? So this one, we've already submitted questions for clarification because I'm going from 6 feet to 8 feet. Again, if it has ventilation, to maximize the ventilation, it's still dealing with cleaning and disinfecting, talks about quarantining of cases, things like that. And then the other major change is to the employer-provided transportation. All along, this section was written mainly for companies that had workers in the United States under the H-2A and H-2B visa programs, that where they were required to provide housing and then the transportation from the housing to the job site. So this regulation, 3205.4, used to be COVID, prevention and employer-provided transportation to and from work. They've taken out the to and from work. So this will now provide to all places of employment that provide where there is employer-provided transportation. So it's not just agriculture, which was mainly H-2A, and food processing, which was H-2B visa programs. And again, it doesn't apply when everyone's fully vaccinated, and doesn't apply to public transportation. So you can kind of look through these changes as well. I just want to point out quickly on our the Standards Board webpage, if you go to the Standards Board webpage, where I found these regulations, you'll find a link for their meeting schedule, and you'll see on here, they hold a meeting once per month. This is where they were supposed to hold the changes. They said they were not adopted. They hold the emergency meeting on June 3rd, where they adopted. And today they're having a special meeting. And this is the only document that they posted related to what they're discussing at today's meeting at 5 p.m. is this June 7th CDPH letter, which addresses the outdoor mega events and additional information for face coverings. So hopefully there will be additional changes. I think what they're really hoping for is to get changes to our regulations that will align with CDC guidelines and align with the governor's plan to really reopen the state on June 15th. Our regulations, once, like I said, once they're on the books, we can't just snap our fingers and make them go away. So we're going to lag behind in the workplace for a little while. So even though CDPH is saying certain things about not needing face coverings, we're still going to require them in California. I have one more link here, but let me see, my little control thing at the bottom is preventing me from seeing it. I want to show just real fast. Oh, I messed that up. Excuse me, let me show you this again. I want to go one final place, oal.ca.gov. This is the
Right
office.
now, sorry,
this is
Dan,
our
right now,
website?
yes, the Welcome to Office Administrative Law. That's what we're seeing right now.
Okay, perfect. Thank you. I just want to let people know, if you want to check the Office of Administrative Law website daily, this is where you're going to find it, right here under the proposed emergency regulations under review and recent actions taken on emergency regulations. So if you go here, this will tell you what happened and when it's been approved. If you go under the proposed emergency regulations under review, you should see right here from Occupational Safety and Health Standards Board, COVID-19 prevention, that was submitted on June 7th. So by June 17th, they have 10 business days to make this approval. So this doesn't tell you what the changes are. That's on the Standards Board page, but this tells you they've received it. It was they received it on the 7th and they have 10 business days. So that's a way to keep up with that. And the last thing, just real fast, I want to show so we can get to question and answers is OSHA's emergency response page. This first box, emergency temporary standards, again, you're going to see some notification on the updates to the standard. If the changes get adopted, they'll get reposted here. The frequently asked questions that Lisa referred about are found right here as well. And here are the sample written programs in Word format. And again, these were posted December 1st, and you'll note they will update the date when they post the updated versions right here. And if you need to see this page in Spanish, there's the link right there for all the information in Spanish.
Hey, Dan, it looks like the share did get a little messed up on this one, so we're still seeing the OAL, but we can share out all these links after the fact.
Okay,
so people will
yeah,
have
not
access.
a problem. Okay, so, oh yeah, for some reason it's still showing that. So let me just do this. So I was just showing our website. Hopefully, did it change screens?
Yes, we're back on the DIR site now.
Okay, so this page is, if you go to our main web page right here, under this first blue box. You'll see the updates to the standards when they get changed, the FAQs with the updated dates, and the sample written programs are right there. And this is what Lisa provided the links to guidance by industry. The webinars right now, we do not have any webinars because again, we're still waiting for the changes to become official and they keep making changes and then we have to submit them for approval before we hold the webinars. So we're working on updating the webinars and then once we know what's happening, again, we will have a final set to submit for approval. And then as soon as we get those, we'll start up on our webinars again. But right now we're just in that interim period because of the changes. We're not holding any webinars right now. So that's all I wanted to share. Now I think we're ready for Q&As.
We are. Thanks, Dan. So that was definitely a lot. We're going to invite Lisa back up as well. So we've been collecting your questions. So thank you for submitting them. Right off the bat, we had a couple questions asking, when does this go into effect? So we had everything from just in general, when the Standards Board announces that they're going to adopt something, how quickly does that turn around to go into effect? How quickly is OSHA going to start enforcing those new regulations as well?
So when the Standards Board approves the regulation, the next step is it gets submitted to the Office of Administrative Law. For the emergency regulation, they have 10 business days to approve it or send it back. The day it gets approved by the Office of Administrative Law, it goes into effect immediately. So it was submitted on the 7th. these recent changes, which 10 business days, 10 or 10, or excuse me, was calendar days, 10 calendar days. So they have to be approved by or sent back by June 17th. And I would expect that there's some pressure to get it approved by June 15th, the reopening date.
Okay. So for example, we have a lot of questions about N95, so we'll get to those in a moment. But just this first one, when do employers need to start supplying N95s for voluntary use for non-vaccinated employees?
It will be when these regulations are approved.
So
Right
16,
now,
17, or 15, 17.
Best practice would be to have them available now. Because you should have them anyway for wildfire smoke. You should have them available for an agriculture in case there's a need for valley fever, for exposure to dust when there might be creating dust in the fields, for soil preparation. So you should have some in stock anyway. And originally there was a shortage, but on the Cal OSHA website, there is a list of agencies or a list of companies that state they have at least 100,000 N95s in stock available for sale.
That's
so
good news.
People should be stocking up right now, not just for this regulation, but to be ready for wildfire season, because they become a requirement under our wildfire smoke regulations as well.
Okay. So on this same vein, we've heard that some of these requirements might go into effect, as you were saying, around June 15th, but then there are other parts of this regulation that they're saying won't go into effect till July 31st. Is there an easy way for people to be able to find this information and track it for the layman, if you will?
I would say the easiest way is to keep checking our website or call one of the consultation offices and just ask, what's going on? Any changes in the last week? Maybe call once, mark your calendar and call every week or so. Any changes in the past week that you're aware of, and just ask a consultant, because we try and keep up. We're trying to keep up with this as well. But that's our job. You need to just kind of make an effort to make sure you stay in compliance and are aware of what the changes are.
Okay. Do we have an idea of if or when Cal OSHA would provide an updated version of the sample COVID prevention program with these new regulations?
I would expect it to go up probably the day of or within a day or two of the update, because I know they're already working on it, on the updates to the program based on the draft that was voted on. So just like the original, when it was adopted November 30th, we had a sample program posted December 1st. So I suspect within a day of the adoption of the changes, there will be a sample available.
All right, I'm going to dive into some of these N95 questions, which I believe we have addressed, but there's a lot of confusion, so I do want to go over it again. So for the N95s, there's a little confusion about the voluntary versus requirement. So there's questions about does the employee have to be approved by a doctor? What about people with any health issues? And then clarification on the facial hair. Do you tell them, oh, well, it doesn't work with facial hair? What's this balance between voluntary versus required use?
Okay, if respirators are required, respirators actually are a last line of defense. We actually have a regulation that says you will look at engineering controls first, administrative controls second, and then PPE, including respirators, as a last resort to supplement those other control measures. So if you require respirators, that means there's an overexposure to some type of chemical or a hazard in the workplace, and an employer would need to implement a full respiratory protection program, which includes a written program, medical evaluations, annual fit testing, annual training. It addresses the storage, use, and limitations of the respirators. There are a lot of elements to that, and if respirators are required, an OSHA inspector would evaluate the company's respiratory protection program. Within that regulation, there is an area that talks about voluntary use of respirators, because OSHA allows workers to wear a respirator in an area where they're not needed because there's not an overexposure. And it's based on the type of respirator that you're allowing the employee to use. For an N95, which is a disposable dust mask, you just need to provide basic training on the use and limitations of an N95, provide the worker with a copy of Appendix D, D as in David, of the respirator regulation. And the training would really be to encourage being clean shaven, that there be nothing that interferes with the seal. Now, during the entire pandemic, you've seen people with full beards, and we allowed any type of face covering as a source control. Now, an N95 will be considered a source control. It's just a finer filter. It's been designed to protect the worker, whereas a source control, the masks that we've been requiring have been really to protect people, your coworkers, from any droplets or aerosols that are coming out of our mouths, versus what we're inhaling. A respirator is designed to protect the person who's wearing it. So the tighter it seals to a face, the more protection it offers. And facial hair, anything that breaks that seal will allow those droplets and aerosols to leak through. So while voluntary use, you can have facial hair, we really discourage it because it kind of makes it ineffective. There was another part of the question you asked. Oh, let me just touch on, if you allow workers to wear an elastomeric respirator, the rubber kind, the soft silicone with the cartridges that fit tighter against the face, that are half face or full face, if you allow that to be used voluntarily, then the voluntary use section of the respirator standard requires medical evaluation for those workers, not for N95s. So if somebody has a health condition that makes it difficult to wear an N95, they should look at an alternative, such as continuing to use a cloth face covering, or an alternative such as the face shield with a drape, if they can wear that.
On that note, does the bandana that we see commonly in the fields, if you pull the bandana over, so it's 2 layers, does that qualify as a face covering?
No, because now under the new regulation, it specifies bandanas. And the reason, I believe the reason for that is because they're typically folded in half, but there's a lot of place for air to leak out here, where a mask has been designed to seal tighter against the chin and cheeks, where the bandana just hangs. And that's, I think that's why it was excluded. I'm not positive, but they're not as effective.
Makes sense. So if this is all under voluntary use then for the N95s, if an employee decides to use their own mask, a compliant mask, would the employer still need to offer them an N95 every day they come into work and say, do you want it? Yes, no, up to you.
You need to make it available for the workers. I don't necessarily think you have to ask them every day if they want a respirator for an N95 for voluntary use. You should just make them available, and the employees, as long as they know they're available, they can come ask for the replacement as needed.
If I could jump in on that real quick, I would just say, from a legal standpoint, yeah, I mean, I agree with Dan. It does seem over the top that every single day you have to make them aware, but you want to keep track of the employees that you've informed. So if you have a way of maybe it's at your weekly tailgate or stand up or whatever it is, remind everybody that you have these available, where they are, where they can find them, make sure it's obvious, have a posting of some kind that makes sure that wherever all of your postings are, whatever you can do to make it really obvious that these are available to them, such that if the division were to come in and inspect, you can point to these as making employees aware that that they are available. But yeah, I don't think you need to literally every day when they walk in the door on the field, remind them.
Yeah, and respirators, N95s really were designed as disposable, but during the shortage, they were allowed to be reused up to 5 donning and doffings. Donning and doffing is each time you put it on and then take it off is 1 cycle. So they could be used, you know, more than 1 day, but we really do recommend against that. And we really are recommending right now not using N95s that have an exhalation valve on it. They're more comfortable to wear, but right now it would allow the unfiltered air to escape into a person's exhaled air to escape out of the face piece.
Okay. And are employers required to offer the voluntary use N95s if they're still maintaining the physical distancing requirements and barriers between employees?
You can make them available. They're not required under the standard if you're maintaining the physical distance and the barriers. That's my understanding. Lisa, do you have anything?
Yeah, I think I agree that if you have other provisions in place, you know, people are at least 6 feet apart, or you have barriers or something along those lines, then they're required. That's my take on it anyway.
So kind of, we'd say the same answer. We just got one asking about crews that are working outdoors, presumably with distance. Same answer.
Yeah. If you're working outdoors, again, if everyone's fully vaccinated, you know, that rule is changing about the physical distancing. But as an employer, you could still follow the old regulation if you'd like and be more stringent than Cal OSHA's minimum requirements. But you know, Cal OSHA will enforce what's in the regulations on the day of inspection.
Mm-hmm. Here's an interesting situation. They have an employee who works indoors and is not vaccinated, but all the other employees in the space are vaccinated. Does everyone, vaccinated or not, have to wear a mask because of that single unvaccinated employee?
That's, yeah. Theoretically, it says as long as everyone is vaccinated in the exceptions. I don't know if I have the latest print copy without going back to look at the regulation. They do address if there's a person that's unable to, they need to maintain the distance, be offered the N95 for voluntary use. I'd have to really go back and reread that part. Again, this is also new in the changes. Let's see.
I think at least I'm seeing in the section under face coverings that says any employee not wearing a face covering and not wearing non-restrictive alternative shall be at least 6 feet apart from all other persons unless they're fully vaccinated or tested at least weekly. So I think the idea kind of being the same thing, if you have other provisions in place, you know, you're remaining at least 6 feet apart, maybe you have barriers, maybe you have other provisions, then if the person, even if the person is unvaccinated, they wouldn't have to wear a mask and everyone else wouldn't have to wear a mask. You have to have all those other provisions in place.
Yeah.
Otherwise, if you can't have those provisions in place, I believe everyone needs to be masked.
That's how I would say, I would agree with that.
This brings us to another question, Lisa, that you briefly touched on there. What are the requirements for an unvaccinated person to get tested? We've heard it might be once weekly, even up to twice weekly, or is it just based on close contact?
I think most of the twice weekly testing has been reduced to once weekly, where testing is required.
Yeah, I was just scanning through to see. I know the section I was just looking at, that was the case where it had been twice weekly and was reduced to weekly. And the regulation is so long.
What was the other key? Did you repeat the question again?
So
Actually, I
it
should just
was,
open.
oh, I think I just, I might have just, oh, here we go. So it's the requirement that unvaccinated employees get tested once a week or only if they were in a close contact.
Okay, I would say they would only need to be tested once a week if they were unable to wear the mask. There was the mask requirement that if they wear the N95 under voluntary use. So I think they would need to be tested once a week if they're not able to wear an N95.
All right. So we are at 2:30, but we've got a few more really good questions here. So I'm going to keep you a couple minutes longer if that's okay. Scrolling up here. So we've heard some of the regulations. Now we'll be asking for training for employees specifically on that the training should include information about vaccination. So sort of a two-part question here. Do all employees who have been previously trained need to be retrained, or does just everyone need to be updated with this additional information about vaccination? How are they looking to handle the training?
I would say they would just need you retrained on the updated information. There's not a requirement for retraining on all the topics. It's just what the changes are. Might not be a bad idea to hit some of the highlights to refresh people's training or ask some questions to see that they remember their prior training, because again, during the OSHA inspection, inspectors will conduct employee interviews to see how effective the training was. And if workers cannot answer the questions, that tells the inspector the training was not effective. So I would maybe ask some questions and make sure you cover the new requirements.
And make sure you document your training.
Always document training.
I'm going to jump here, given the documentation question. And actually, before we get into all the questions about how to track your employees' vaccination, I will say that next week on the 17th, we have another webinar, which is also free, supported by the Western Center for Agricultural Health and Safety. And that's going to dive into more of these really labor law questions about discrimination and privacy. So do sign up for that, because we're going to get some focus on those. But let's see here. For the documentation of vaccination, what information do you need to be tracking? Is it just their name, the date they're vaccinated? What other information should you have on file?
That's such a good question. I think that falls into the category of, I mean, Dan can correct me if I'm wrong, but we don't really know just yet. And during the standards board meeting, that was a question that came up, as you can imagine, a lot. And Eric Berg had commented that they were going to put together an FAQ on that. So I'm hoping that it answers that. Dan, I don't know if you have more information on that than I do.
Yeah, there will be a frequently asked question about that. But under the definition of fully vaccinated, it means employer has documentation showing that the person received at least 14 days prior to either the second dose or 14 days after the single shot. I would probably recommend against getting copies of the vaccination cards. I know, would you agree with that, Lisa? I would maybe suggest keeping a log, and that somebody has verified that the card has somebody's name on it. They've received both their doses and it's been at least 14 days, and maybe keep a spreadsheet with that information. But there's nothing, it says has documentation, which is very vague. And I think documentation can include that, no, this person physically saw the card and we made a note of it, maybe write down the dates, or, minimal information that it's, put a check mark by the person's name that they've received the vaccine and that it's been at least 14 days. until
Okay.
we at least get additional guidance.
Yeah, I agree. I think it probably is a good idea to keep the information as minimal as possible, but also to demonstrate that you have verified in some way. So yeah, if you have somebody who can say, I saw the vaccination card and I took down this minimal amount of information, then hopefully that should be enough. But yeah, I agree.
Yeah, there were a lot of arguments about at the board meeting about HIPAA requirements, a violation of HIPAA requirements, and asking for a vaccination card is HIPAA requirements are mainly for the healthcare industry, not most workplaces. And the California Department of Fair Employment and Housing has stated that you can get this information and it's you're legally allowed to ask for a copy of it or to see it, but I'm not sure. I don't remember if they said you could receive a copy, but I would again recommend against it until there's further guidance.
So they can ask for it, but we won't take copies, just to reiterate. And we're getting a lot more questions on this, and both for the sake of time and also I'm going to point to that webinar next week, because that's really when we're going to get in depth in all these questions. We'll be able to go a lot more into it, specifically for, again, those labor issues about privacy, discrimination, and whatnot. All right. Oh, here's a good one. I think we're going to get a quick answer on this. So when an employer needs to send employees for testing, vaccination, buying those N95s, will we be reimbursed by the state government?
No.
No.
Sorry.
Sorry. There are, just be aware that at least for wildfire smoke, the Office of Emergency Management, OEM, has made stockpiles of N95s available to the agriculture industry in the past for wildfire smoke season. I don't know if they've got how much a stockpile they have right now because of the pandemic, but in the past they have provided them for free to the agriculture industry. It's for N95s.
All right, I'm going to shift topics a little bit here. Just a couple more questions. Thanks so much for staying on with us a little late here. We appreciate it. Are we expecting any updated guidelines for the sanitizing of common touch surfaces under the revised ETS?
There
We
were
don't
some
know.
very minor there were very minor changes to that section of the standard. What they've been talking about recently has been really with physical distancing and facial covering. So I would expect there to not be any significant changes to those sections on sanitizing, cleaning, disinfecting, unless CDC comes out with some major change, and we'll have to wait and see if that gets adopted.
All right, couple testing questions, and I think we'll be done till next week when we are going to address a lot more of those questions about, like I said, labor laws, discrimination, and privacy, about what we can ask as far as vaccination and proof. So don't worry, June 17th, come back with us again. We'll be here. Back to this idea of if you have one single employee who's not going to get vaccinated and everybody else is, can you just have that one employee be tested every week so that nobody has to deal with the face coverings anymore? Yeah, can we test that one unvaccinated employee weekly for a negative? That way no one has to wear face covers.
I actually need to look at the regulation for that. Let me see if I can pull it up quickly and see how that was worded. Yeah, that one is tricky because I've had questions on that as well. And I'm trying to figure out if the logic to that is pure pressure to get the people vaccinated, or what employers are supposed to do when they have, just one person away from being fully vaccinated.
Yeah, the only thing I had seen when I was just scanning through is again, referring to employees who aren't wearing face coverings have to be 6 feet apart unless they're either fully vaccinated or tested at least weekly during paid time at no cost. So seems like that could be read to say either you have to be fully vaccinated or you're tested weekly and you cannot wear a face covering.
Yeah, I think that's how I would.
Subsection, let's see, it's under face coverings.
Would be C27.
Yeah.
Or 6 is physical
C7,
distancing.
under C7.
Okay, sorry, I had some audio issues there. All right, one more question. One more question. I think we'll be done for now, but don't worry, we'll be back again. What about keeping records of testing? What are your recommendations that employers should keep on file as far as their employees getting tested?
Lisa, do you have any recommendations?
Yeah, that's hard. Again, I think it really comes down to keeping just enough information without too much detail, but you know, it makes sense if you have a spreadsheet situation and you have specific employees that have to be tested, having some kind of a basic format that you're filling in that somebody can verify. And because really what it comes down to is, at least as long as you have some kind of a record that somebody can verify. And so it's not just someone coming in saying, oh, I got tested and it was negative. You have to be able to verify that it was negative. And you can't necessarily take their word for it. So whether that means you're providing testing on site or you know, you get to look at the results. Again, I don't think you need to collect that yourself and hold on to it. I think, you know, kind of like with the other types of documentation, it makes sense to just have a way of tracking it that gets the information you need without collecting too much information that you have to hold on to.
I would agree with that. I will tell you, within Cal OSHA, we are required to submit our results to a unit within the Department of Industrial Relations who's maintaining those records. I believe probably confidentially, but we are required to submit ours. But I would tell most employers, just maintain some type of documentation that you are testing those workers on the required schedule.
All right, well, with that, I know we have a lot more questions. We all still do with this constantly changing regulation. So like I said, definitely sign up for that free webinar next week on June 17th. We'll get a lot more into your questions about that record keeping and what you can and cannot ask as an employer. This webinar has been recorded, so we're going to send it out. And just want to give a huge thanks, Dan and Lisa. Thank you so much for your help in navigating this. I know it's a lot of questions, but we really appreciate your insights. Also want to give a huge thanks to our sponsor, the UC Davis Western Center for Agricultural Health and Safety, for helping us bring this to you and at no cost. And of course, thank you as always to our interpreter, Clara. Muchísimas gracias. All right, with that, we will catch you next time. Stay safe, everyone.
Thank you.
All right.